The last video for this chapter is going to finish out the last few slides. So we're talking about anticholinergics, antispasmodics, and antidiarrheal medications. So we've already talked about the term motility. That's referring to involuntary movement of food through the GI tract. And if everything's going the way it's supposed to, so to speak, we have the right amount of motility. Too fast, we end up with diarrhea. Too slow, we end up with constipation. So if a person has either a short-term illness or maybe some sort of an autoimmune issue like irritable bowel syndrome or Crohn's disease, they might have a lot of spasming, diarrhea, and a lot of abdominal discomfort. So we have some drugs that'll take care of that. So you might find that your patient has abdominal cramping, bloating, other abdominal pain, and this can be from existing illnesses like ulcers or colitis, or it can just be a GI bug. Now, of course, layman's term is stomach flu. You hear that all the time, and you might even use it yourself. But in reality, there's no such thing as influenza that affects the stomach. Now, as part of the whole respiratory influenza, a person might be irritated and have a little bit of GI distress, but there's no such thing as the stomach flu. So usually a viral illness is going to cause a GI upset, usually referred to as gastroenteritis. And it's usually caused by a virus, although it can be bacterial. Usually it's short-term, it's self-limiting, and not especially dangerous to the average healthy person. However, somebody who's older and in debilitated physical condition might have some problems. Now, going back, I said this table was a little bit backwards. So if you go back to page 257, table 13.3, you see the anticholinergic drugs and antispasmodic drugs listed ahead of the laxatives. So we're going to talk about a couple classes of those drugs that can be ordered for diarrhea. So what we use these for, they reduce spasms of the GI tract. They cut down on intestinal motility if it's a little bit too fast. Along with that, they also will help to cut down on acid production, because when the GI system is moving too quickly, the patient's body is going to sense that as, oh, we got all kinds of food coming in, we got all sorts of things that have to be handled by the stomach, let me make some more acid. So many times along with a GI bug or gastric irritation is going to come increase acid. So if we can slow that down, that's going to slow down acid production also. So that reduces the pain and discomfort that a person might find if they have a lot of different situations going on. And the PowerPoint gives the example of peptic ulcer, pylorospasm, which is spasms of the pyloric sphincter at the bottom of the stomach, biliary colic, which is the medical term for the kind of pain that you have when you have gallbladder disease, hypermotility, anything that irritates the colon, and then acute pancreatitis, which, as I've mentioned before, is said to be one of the most painful conditions. And it involves abdominal pain, nausea, and vomiting, and it also might include a lot of lower GI discomfort. So anticholinergic drugs or antispasmodic drugs will help with this. Antidiarrheal drugs will reduce the fluid content of the stool, which cuts down on peristalsis and motility. That also increases smooth muscle tone in the GI tract and kind of diminish those excess secretions. So it sort of dries things up. So this can be treatment for nonspecific diarrhea, diarrhea that we know is caused by antibiotics, and some people have more of a tendency to get that than others. So if you look on page 257, we have anticholinergic drugs, and the example they give you is dicyclomine or Bentyl. Bentyl is sort of a antispasmodic. It stops cramping. It's taken PO, and many times it'll be given with drugs that are a little bit more, conditions that are a little bit more chronic. We also have antispasmodic drugs. And antispasmodic and anticholinergic, they kind of go hand in hand, because you'll see an example that they give is atropine. And we know that atropine is like the prototype anticholinergic drug. There used to be a drug, a form of atropine solely given for GI distress, and it's called saltropine. That was capital SAL dash tropine, TROPINE. Most of the recent drug books show that that's kind of fallen out of favor and is no longer being used, but that was a form of atropine used solely for that. But you can see they give you examples: hyoscyamine, phenobarbital, and scopolamine together make a drug called Donatol, which is a pretty potent reliever of colic. And then down below, we see some opioid agonists. These actually function a little bit like opioids to help stop diarrhea. And we're familiar with those, Imodium and Lamodal. And Imodium they usually will sell over the counter, and you'll take that maybe for mild GI problems and diarrhea. And the Lamodal usually gets recommended for cases that are a little bit more stubborn. So we see that we have diphenoxylate with atropine. Diphenoxylate is a very mild opioid. It stimulates some of the opioid receptors. So there are actually message boards that I found completely by accident, I promise, that tell a person how to process the Lamodal so they can get a high out of it. And there have been cases of people who've taken just tons of Lamodal to the point where they have ended up with cardiac problems because they're trying to get a buzz off their anti-diarrheal drug. So, not real smart. Last slide. These drugs can interfere with other medications like the GI stimulants. And a few lectures back, we talked about metoclopramide or Reglan. If you combine Reglan with drugs that inhibit the cytochrome P450 systems, such as Tagamet, which I gave the example of earlier, that can cause a cardiac dysrhythmia, and so patients should really be watched closely, especially if they already have a tendency to have cardiac arrhythmias. On page 260, we have patient and family teaching for the antidiarrheals, and we also have nursing considerations for diarrhea drugs. So make sure you read those. You'd put all your whole nursing process into action. On page 259, there's a memory jogger that's very important. When diarrhea is caused by infection, many times it's a good idea to not give antidiarrheal drugs. If you've got E. coli or salmonella or some other food poisoning or some other type of poisoning, you want that product out of the body. And sometimes diarrhea is the best way to do that. Like a lot of other body functions, diarrhea is for our protection, to get rid of things that are not agreeing with us and are not doing well in the GI tract. And food poisoning and other types of poisoning are no exception. So if you know for sure that the GI bug is caused by antibiotics or something else that you're on, you can go ahead and take something. Many times the healthcare provider will recommend that. But if it's some kind of a poisoning, generally they just want to do supportive care while your body rids itself of this toxin. So in this case, they're going to maybe put you on an IV for liquids, especially a patient who's older, maybe electrolyte supplementation, and just really good skin care, because we all know how uncomfortable continued diarrhea can be. All right, that is your lecture on chapter 13. Like I said, generally I give 13 and 14 together as a test. However, we just have no idea how this is going to play out. So I will be keeping in touch with you as far as what to expect. I will be posting some assignments for these chapters in the event that we cannot come to school, and I will let you know about what form of testing we're going to have. So please continue to check in on Edmodo. I recommend checking in by 8 every morning, checking in again at noon, checking in again in the afternoon. As always, please call and leave me a message on my office phone, and if we are able to be here at the school, I will be here to answer it. Otherwise, send a message to my email that hopefully you have on your syllabus, which hopefully you still have in your possession, because I can access my email on my phone, and I will try to get back to you as soon as possible. So let me know if you have any questions, and continue watching these on Edmodo or on YouTube using the links. All right, talk to you all later.